Hi, everybody. It's Jessica DeMassa with WTF Health. What's the future health? We are talking to the who's who of health tech, and today we are in for a treat. Joining me, I have Dr. Lyle Berkowitz. He is a man with a lot of talents, a digital health and telehealth expert. He was the former director of innovation at Northwestern Medicine. He is a primary care physician. He was the former chief medical officer at MDLive. Oh, and in his spare time, founded a company, Health Finch, which he then sold to Health Catalyst. Lyle, holy cow, what a resume. It's good to have you with us to talk all things telehealth. That's what we're going to chat about today.
I'm ready, Jessica.
All right. Lyle, some of you might remember Lyle or recognize him from our Teladoc-Livongo merger piece. He weighed in and provided us some perspective on how that deal is going to change the face of telemedicine moving forward. And, Lyle, I want to back up now and just go a little bit deeper into some of the stuff that we touched on in that interview. So I want to start out with actually some of the data around telemed visits. I'd like for you to rumor check for us. I mean, I love this idea of you being this rogue consultant in telehealth and telemedicine, because I feel like you're going to tell us the truth. So what are we really seeing here? I mean, I saw in a recent Stat News article, they had some data from Epic that visits are down. Telemedicine encounters were at 1.69% of all visits in April. We get to July, we're at 21%. I mean, what do you think of those numbers? Are those statistics that we can believe? And what is this really showing, as far as the trend in terms of patient health consumer utilization of telehealth?
Yeah. So first of all, it falls under the old Mark Twain quote. There's lies, damn lies, and statistics. So the numbers are a little confusing sometimes. What happened is, you had a huge increase in telehealth visits, but at the same time, you had a total number of visits went down. So the percentage looked higher. So if in February you had 100 visits a week for a doctor, you actually might have had 50 visits a week. And so when you say 75% of those were telehealth, that was actually only like 30 or so visits. So now that we're seeing everything go back to a more balanced approach where there's more office type visits, there's a big swing in the percentage, but you want to look at the absolute value also. So in general, the absolute number of telehealth visits is down a little, but the percentage is down a lot because the total number of visits is going back to normal. And a lot of people, as often happens with statistics, miss some of that subtlety. I think it's fair to say that we're looking at a new normal of around 20 to 30% of visits will be telehealth, which is great. That's way more than where we were before, which was under 5%. And also important, a big distribution. We've got psychiatrists and mental health professionals who are still at, maybe 80% plus. Primary care doctors, chronic care, and urgent care type stuff that still might be 25, 30, 35%. And then specialists who do procedures like ophthalmology, et cetera, they might be under 10%. So there's a combination of things to look for and the subtleties of that.
All right, I want to unpack some of the different areas of care and their commitment to telehealth or not. But before we get there, I just want to kind of to get a summarizing statement for you there. So are you worried? I keep hearing not even the genie's out of the bottle anymore, because somebody pointed out that it can easily be sucked back in. But the toothpaste is out of the tube is the new one. So, I mean, are you concerned at all in seeing the numbers, trend downward a little bit? Should telehealth companies or digital health companies that provide adjacent services, should they be worried? Or do you really think that, we've turned a corner with virtual care and it really is going to become part of the norm? Hospital systems, physicians are going to start embracing it in a different way. What are your thoughts?
Yeah, so let's talk the big picture. Like I said, I think the new normal is around 20 to 30%. I think it should be more. I think potential is more, but that's still really great. But it's only going to continue with three things, the three R's. Doctors, we love our acronyms, right? So regulatory change has to continue, promoting and enabling virtual care. Reimbursement needs to continue. Right now, it's great. It's basically parity. And so it's a lot easier for docs to say, okay, I'll do video, phone, etc. Not sure how that's going to play out. A lot of folks believe that video will remain close to parity, but phone may not. And as that reimbursement changes, that's going to be the critical part of whether or not we're able to continue that momentum. The third R is what I call regularity. Basically, culturally, efficiency wise, just the overall feeling? Do we feel this is the new regular enough? Are doctors and patients both comfortable with it? I knew patients would like it. It's great for them. It's what they expect in every other industry. I'm shocked how many doctors actually like it more than I realized across the board. They love being able to work from home. They love being able to mix it up. Some of them may decide to go and become virtualists full time. Many of them, though, are happy doing it as part of their lifestyle. They just have to figure out how to make it a good and normal part of their schedule and get paid for it.
As far as like the hospital side of this, let's talk about that for a second, the established healthcare system. So I love what you just said about how more clinicians seem to like it than you even expected. Is it when that, I guess, like when you roll that up and you look at, those who work in health systems or in hospitals, how ubiquitous do you think the adoption of telehealth and pushing people into a virtual first, pushing patients into a virtual first entry into those health systems, how broad scale do you think that strategy is going to be? Like, is this really like the, like if you borrow the metaphor from retail, is this like really their e-commerce strategy in terms of augmenting the physical location of a hospital? I mean, I feel like we've had mixed reaction from, the incumbent healthcare systems and hospitals in terms of how willing they've been to, move into that virtual care setting. Do you sense that as well? What's your take on the way hospitals and health systems are reacting?
So let me start by defining two parts. Part one is virtual health. I like to divide into telehealth, which means a doctor and a patient are communicating,
Okay.
whether synchronous or asynchronous, and autonomous health, which is where a health system can communicate with a patient without a doctor involved. So this is your chat bots, remote patient monitoring, et cetera, that may monitor and educate a lot of patients, but only escalate to a doctor or other provider if there's a problem. So, if you look at that, and then on the other axis, you look at the area of care. So in primary care, I think what we can and should see is a lot of virtual health, and a lot of that should be autonomous. The truth is, a lot of what we do as primary care doctors, and for 20 plus years did that, can and should be automated, delegated, etc. And you don't need a doctor to diagnose and treat a sinus infection. You really don't. But we mandate that because that's how we get paid, etc. But with a shortage of doctors, that really shouldn't be where doctors should be focused. Even managing chronic care stuff, that's where Livongo and similar companies make sense, because they're starting to automate and delegate some of that routine chronic care. So in primary care, I see it happening a lot, and really looking at 50+% of primary care can and should be automated, delegated, virtualized, etc.
I want to challenge that for a second, because I know somewhere in my Twitter feed, Jay Parkinson is from Crossover Health is just dying to weigh in on this. And the thing of it is that they argue, so Crossover Health, obviously primary care clinic, very much focused on being in person and delivering in-person care via their clinics. And, his argument continues to be, that there's a lack of continuity of care with telehealth that's provided via primary care. It's like a Russian roulette of doctors. You get a different one every time. And I know for a fact that's not necessarily always the experience. Depends what service you're using, right? But I mean, what do you think about that? I mean, push back on some of those challenges. I want to play devil's advocate here. What do you say about that?
So first of all, Jay and I have been going in learning from each other for many, many years. So
That's a beautiful way of saying it, Lyle, learning from each other.
And he and I were both like highlighted in the late 90s for using email with patients. I was in Chicago, he was in New York. So in terms of virtualizing, I know he's fine, and he's been one of the pioneers of pushing that. And the issue is the continuity aspect of it, and whether it's in person or online. I agree, that's great, but I also have to look at the reality of the situation. Crossover is wonderful. If you work at Facebook or Google or Amazon and someone's paying for that, that's great. It's a concierge level care. Guess what? Most of America doesn't have that. I've always said we don't have a shortage of physicians in America. We have a shortage of using them efficiently. And the truth is, at some point, a lot of primary care and in some specialty care is commoditized. And we don't like to say it, but it's true. It's routine, repeatable, it's easy. I could teach a nurse to do it. I could teach you to do it. It's that simple. What we need are to know, whether it's a doctor or a person, a coach, or an AI robot, when someone needs to be escalated. So not everybody needs to have a doctor for much of their primary care, and particularly if they're under 50 years old.
Do you
And
think
so,
Do you think
so
primary care is going to be the battleground? Like, I mean, if you're going to like look ahead here, right? Like, through the pandemic, as things start to change there, a vaccine is introduced, all of that, is primary care going to be the battleground in terms of gaining market share, in terms of, visits and gaining patient billings? I mean, is that where we're going to be fighting this fight, or is it going to be, in a different area of healthcare?
on one hand, yes, it is going to be the battleground. That's why all the you're seeing more and more payers, Optum, Cigna, Humana, buying up physician offices, because whoever owns primary care owns the spigot for everything else that follows, and that means you do better preventive care, particularly as we move to, yes, Jessica, value-based care. That is, primary care is going to be essential. But even in a fee-for-service environment, primary care, again, that's who holds the hose, the spigot, where everything goes.
And that's true virtual as well as in person, right? In your opinion, that's true virtually as well as in person. Okay.
Yes. And the only reason we haven't done it more virtually is because of reimbursement. In the 1990s, we were in HMOs. Half our patients were in HMOs. And guess what? If you called up with a medical problem, we're going to take care of it by the phone, because we're not getting paid anything extra to have you come into the office. So the funny thing is, we're back to 1990s HMO level care with a lot of these patients. Virtual care is nothing new. Doctors have done it for decades. We just weren't getting paid for it, so we didn't stress it. So I had no problem thinking, but the real battleground is how we're going to do it efficiently. And my argument is there are not going to be any more primary care doctors in the 10 to 20 years. We don't need, doctors are unbelievably well-trained individuals. They're going to need to move into either the higher end, the top of the pyramid of primary care, which I'll call complexologists. That's your MA plans, your ChenMeds, your Oak Street, your Ioras. That is where the traditional internal medicine primary care doctors are going to wind up. And for the 80+% of routine, younger, healthier primary care, I think that's going to go to PAs and NPs. And if I have my way, it'll be all computers. Just think about travel agents and bank tellers and so many other things that we used to do in person. I think we can do more and more of it, not only online, but it can be done in an automated fashion.
Yeah, I mean, it just sounds like, leveraging technology to triage in a more effective way at a macro level. I like that.
Triage, diagnose, treat. I think it's where we need to head to save our healthcare system. Because again, if we do that, then we'll have enough doctors for everything that really need. And the patients who really, really need us are the ones who are sicker at the top of that pyramid. And I'd argue that a computer can usually do a better job of diagnosis and treating routine stuff than a doctor who sometimes gets bored and may forget to ask a question.
All right, so at the top of that pyramid, that's as these complexologists, as you refer to them, that's like before you transition into the hospital, right? In your mind, or is that kind of a blur? Like I want to understand the bottom I get, you're common, your cold, your UTI, the easy stuff that, is maybe acute, or your office visit, your routine exam every year. But when you get to the top of that pyramid where it starts to transition into being more complex, I'm curious how much care you think can start to come out of the hospitals. So the things that people might go inpatient for, or that they might have to go and visit a specialist, like how much of that do you think can come out? And if that does come out, what do hospitals have to do? Can they survive without those billings? I mean, I feel like we've been hearing them, make a lot of noise, especially during this pandemic, about, their financial situations. As a result of people not coming in for some stuff. So, I mean, what are your thoughts there about that level of integration in telehealth?
So let's be honest, hospitals don't want mildly sick, people who just need a little care. They want procedures. At hospitals out there, and they make money in fee-for-service, usually via 5 service lines, right? Orthopedic, general surgery, transplant, cancer, and 1 or 2 others that they may have, neurosurgery, etc. Big, meaty procedures, and they need to feed the beast. That's where primary care and basic specialty care comes in. Is basically we're just all tending the garden and waiting for something to sprout up, grab it, and hand it into the big hospital system. That's how they make money today in our fee-for-service world, which isn't going away. As we move to more value-based care, there's still a balance of they still want those big procedures for a variety of reasons. There's still, even value-based care, maybe some blend of fee-for-service models for some of the big procedures. But what we'll see, I believe, is ideally getting a stable level of care to more people. What we have now, of course, is a maldistribution, the classic. We have the best medical care in the world if you can get it. And problem is not enough people get it. So I'd rather say, let's everyone get a base level of care that may be automated. The next step is you got to talk, okay, we've escalated to virtualists to figure something out. And then you get to the complexologists at the top. And the truth is that we do that and we can figure out how to engage the people who are really sick but aren't doing any care. That will help a lot, because the biggest problem the health systems have are people without insurance or with really, really shitty insurance who wind up coming in and needing some major procedure, and they're on the hook for that.
So I love this idea because I feel like you're very much in alignment with what Teladoc and Livongo are trying to do. I mean, I think that like what you're espousing here, it's kind of like this. So the recent book that was published by Hemant Taneja and Steve Klasko called Healthcare, and they're arguing for this health assurance system. And it's basically that kind of democratizing care by using technology to offer those who may not have good access to insurance, an opportunity to, use lower cost digital solutions for some of those everyday basic healthcare needs, in order to kind of, realign the system so that, you're only going to the hospital for dire healthcare emergencies. A lot of that stuff that can be mitigated in between is used through a mix of digital health, telehealth kind of services. And then the rest of it is kind of a remote monitoring day to day. Let's try to do our best to stay healthy in real time here. So I'm curious about the market and what your take is on all of the movement happening with some of the big telehealth companies, and whether or not you think they're going to own this healthcare model of the future. I mean, I think everybody's looking at Teladoc-Livongo as like a new kind of the first real at scale version of what this could be if you look from end to end at integrating technology and providing that full-on experience where things are triaged and elevated at appropriate times. I mean, there's the potential to do that. So I mean, talk to me, I guess, a little bit about whether or not you see the potential there, and if you don't, maybe how some of these other players who are in the space, Amwell planning to go public, your former company MDLive, also with IPO rumors out there, Doctor on Demand, they've raised a lot of money. We've even seen SOC Telemed, they're planning to go public as well. I mean, talk to us about the market and really who's going to own this healthcare system of the future that's got this end-to-end digital experience baked in the center of it.
So I love the concept of what we'll call virtual primary care, really being able to do everything online. Doctors on Demand came out first with it. MDLive's, trying to start in there as well. But Teladoc and Livongo combined seem to have the best potential to be able to really do, as you said, end-to-end, right? They had traditionally done urgent care. They've added on some second opinions, et cetera. With Livongo now, they have chronic care. They have done mental health for a while in both sides.
Yeah.
They probably need to do a little better on the preventive health side, but you are seeing already companies coming out, insurance companies coming out with a virtual first plan. Sometimes it's a supplement, but more and more we're going to see you, employee, can choose a virtual primary care plan. It will be cheaper and everything will be online. Young people are going to eat it up. 98.6 has been doing some cool things, at least based on their PR of being able to do something like that. So you guarantee that you're going to see more and more of this coming from the payers using these folks, except big difference after COVID, who's doing more telehealth visits than anybody else, far more than telehealth, Teladoc, etc. is all the health systems.
Right.
The health systems now are doing the vast majority of telehealth when you add them all up. And in fact, I would argue your health system, you better be thinking about what is your virtual primary care strategy. And you should be talking to your local payer. You should be talking to your primary care group and thinking about how do we offer this, because it's going to be increasingly in demand. People are used to doing everything from home. They don't want to go they never want to go into the office. Don Berwick used to call it, the tyranny of the office visit. But now they're scared to go into the office visit. They are petrified of going anywhere. And so all these things come into play with reimbursement to, again, set it up so that I think we're going to see that happen. And when that happens, whoever controls all of that controls the spigot for specialty care, hospitalizations, et cetera. That will be critical. And that, I think, will be the great new model to look for.
Who do you think wins in this space? Is there anybody that you've got that you've just tagged? I mean, I hear a lot about, I mean, Teladoc in the proxy that they issued with Livongo, they list their 2020 expected revenue. It's like, it's close to $1 billion, 988. I think, and can anybody catch them? I mean, can Amwell catch them? Do they want to catch them? Can Doctor on Demand catch them? MDLive? I mean, as far as market share, or does that, and this was the other side of the Teladoc-Livongo merger, is has Teladoc now caused itself some trouble by becoming the competition to some of those health systems that were their customers, the ones that you've just said are providing more telehealth visits than ever? What do you think? Who's going to win this, Lyle? Give us, like, you're not affiliated anymore. I want some hot gossip here.
So first of all, the health systems have a huge opportunity here. Let's hope they don't shoot themselves in the foot to really jump on this. With that said, the good news is all the boats are floating up. It's, even though you could argue that a year, so there's 1 billion outpatient visits a year. Last year, all the telehealth independent, the Teladoc, the Amwells, Doctors on Demand, MDLive combined, they were doing 10, 20 million visits of that billion. This year, let's say they'll do double that, maybe they'll do 40 or 50. But if you start looking at the 20, 30% of visits of the billion, that's 200-300 million being done by the health systems. So they own that right now and they can do a lot. But the good news is there's not enough of them out there. And the independent telehealth providers, again, their boats are all floating up as well. Lots of demand supply mismatch. However, as we move into more automation, it's going to become a little more competitive. It's certainly going to become more commoditized.
So wait, are you putting your money on the health systems? Is that if we were to summarize this up, is that who you think is going to come up big?
Who is going to do the most telehealth visits moving forward? Absolutely the health systems. But that's combined across the nation. Any one health system, is still doing less than maybe a Teladongo, right? So does Teladongo win? My God, they just crushed it. Right now, they're far and away, both depth and width, high, bigger and better than everybody else with respect to the volume that they have, the breadth that they have, etc. So they have a big opportunity to own a new space. And I don't think necessarily they're going to be competing directly with the health systems. There are lots of patients who are not affiliated with health systems. You and I and all the people we know, we're probably pretty affiliated, but less so than you might think. But there's tons and tons of people, lower socioeconomic classes in particular, who aren't particularly associated with a health system or see someone regularly, and doing something online that's subsidized is going to be a lot easier for them. That said, what's going to happen? I think that we'll see Frankenstein emerge. An amalgam second, right? We're going to either, whether it's a PE or Amwell pursuing it or someone, we're going to see some weird mergers happening, right? Is it going to be Amwell and Doctors on Demand and Omada stitching themselves together, buying some other stuff? I don't know yet, but it's going to happen because they can't last, or they're really going to be, fall away if they can't start competing with the big boy. And to compete with the big boy, you got to get bigger and wider and fast. And so I think over the next couple of months, we're going to see some interesting moves.
I love speculation on M&A.
Something's going to happen.
I love M&A speculation. That's one of my favorite things of all time. I'm like, ooh, say some more companies in that mix that you just, who else can we throw in there? Lyle, so how does this, I guess last question for you. I mean, we talked at the top about how, it's not just telehealth that you have expertise in, based on your roles. And I would love to hear, how you think this all is going to impact digital health more broadly. I mean, there's a lot of companies out there than just the ones that we've been talking about. You get outside of the telehealth providers, there's even like the specialty telehealth providers. There's a whole lot of mental health telehealth happening. There's a lot of peds telehealth happening. And then beyond that, even further, you have the businesses that really provide, different services that augment that virtual care delivery. The different apps that are out there, the remote monitoring companies, some of those companies that help facilitate data exchange. What's the ripple effect, in your opinion? As somebody who's watched this space for a long time, you have your relationship with Health Catalyst, which is a tremendous company, involved in helping health systems make sense of their data and use analytics. What's the bigger impact on the entire category of digital health in your mind?
So I think it's great if you're in one of these niche companies, of which there are a lot. And you're right, some of the niches are in a specialty, right? Behavioral health, easy one. Some of them are, and things like speech therapy, physical therapy, or cardiology. We're going to see these really interesting niche telehealth companies, and they're going to they're going to go really deep in one area, and now they've got a big daddy to go to get bought. So that's great for them because they can survive on their own, or they can think about rolling up into the big companies out there. Second, you have a whole nother niche, which are sort of those that support everybody.
Yeah.
Whether it's like translation or AI, speech to text, or education, or some other way to maybe make the video better, make the audio better, any different way that you can support. And then instead of going deep, you're going really wide, real thin line that can basically be bought up by any of the companies to use. So either of those things are going to be really important. I'm a big fan of the digital diagnostics. Using AI, there was at the Health Catalyst conference, there was someone speaking from a company that does it was a Healthy IO, right? They take a picture of your urine test that you I guess you pee on some piece of paper that they give you, you take a picture of it, and it diagnoses a UTI or other urinary problems. Like, that's awesome. There's a couple companies in the space of vital signs where you hold your phone up against your face, and their blood pressure, pulse, soon to be temperature, pulse oxygenation level, like that becomes ubiquitous. Those are really important for many and many of the different telehealth companies. So I'm looking forward to all of those. What Amazon just announced, we didn't even talk about that. Halo, right? That thing, did you read what it's doing? It's going to be listening to you. It's going to probably diagnose you with depression or maybe hypertension just by the sound and tone of your voice, by checking your body mass and your body fat and telling you whether you're getting fatter or slimmer, probably suggesting some clothes to wear and exercise equipment. Those guys are brilliant.
It really is. It's brilliant. It's exciting time. I think that, if there's one, positive impact of the pandemic in terms of healthcare delivery, there have been a lot of, obviously a lot of tragedy, but there have been a lot of positive things in the way that I think the healthcare system has pivoted. And broadly, I don't just even mean the health tech companies. I think even the incumbents as well have really kind of risen to the occasion and moved faster than I think a lot of us ever thought was possible in order to help, make sure that people get the care that they need. Lyle, it was a pleasure talking with you.
Jessica, I love your style. Great questions. I know we still barely scratched the surface.
No, we're going to have you back again.
For you. I know you
I didn't ask intentionally any follow-up questions about value-based care, but I know you're dying to talk to me about it.
I got to say something about this, because as much as you make fun of it, you have to realize that you're thinking about everyone going Captate, Kaiser Permanente. No, remember, even at a completely fee-for-service health system, when I was at Northwestern, we still point out the fact is there's a lot of care that's bundled, right? We are talking about using telehealth in the hospital or out after the hospital. So you do surgery, you send someone home, you want to send them a monitor, you're on the hook for that. So that's value-based care right there that happens every single day.
You're preaching to the choir, but it's one of those things where it's like the conversation just stops. It's like you hear the record skip, like whoop, like there we are. Somebody had to mention value-based care. Everything was going along great. We were all getting along swimmingly. I'm a fan, but it's just, it's funny. Somebody's always got to bring it up. Lyle, thank you for being that guy. And thank you for weighing in with your expertise. And really, I love always hearing from physicians, and hearing how I always feel like physicians are, natural entrepreneurs. And so I love hearing about, the different ways that you have managed to be an entrepreneur in your career, starting your own company, getting it bought, and then just even the roles you've played advocating for technology in the organizations in which you played those roles. I mean, phenomenal. So thank you so much for stopping by. We'll talk to you again very soon. Thank you so much.
Thank you, Jessica.
All right, everybody, if you want to hear more interviews with thought leaders like Lyle, tune into WTF Health on YouTube. Just search me there or go directly to youtube.com/WTF Health. You can also sign up to get my cute new email newsletter delivered directly into your inbox. I am curating flights of conversations on specific themes. So just go to WTF.health. That's my website to sign up there. Thanks so much for joining us, everybody. We'll talk to you soon. Stay well.